Sir, I'm Dr. Chong Yin. I'm here to assist you today. First of all, I have to know what is your name.
Alexander Yugovich.
And how old are you this year?
50 years old.
What do you do as a living?
Business.
Where do you live?
Dimitrova Kurs.
Okay, may I know what is troubling you?
I've been having fever for 3 days.
Fever for
And
3 days.
Cough with sputum.
Cough with sputum. Do you know what is the temperature of your body temperature during your fever?
Don't remember exactly, but 38. I think 38, around 38.
Okay, around 38. And you say you have cough with sputum. Can you tell me what kind of color is the sputum?
Yellowish.
Yellowish color.
And chest pain.
Oh, okay. You're having chest pain. May I know which exact part of your chest is having pain?
Oh, yeah. Left side.
Okay. Oh, left lower chest, huh? Okay. Do you have any idea when you start having left chest pain?
2 days ago.
2 days ago, okay. Within this period of time, did you take any medicine?
Yes.
What kind of medicine did you took?
Paracetamol.
Okay. Did you went to the doctor?
No.
Okay. But throughout this few days, you didn't have any trauma, right?
No.
Okay. Do you have any idea why you started having cough and having fever?
I think 3 days ago I was drinking alcohol outside without wearing jacket.
Sir, do you know what things can intensify the pain in your left chest? Is it without reason? Or maybe when you breathe in?
I think when I breathe very hard and also with aggressive body movement.
Okay, I see. Okay, so just to confirm, I still have a few questions for you. Do you have any gastric ulcer before?
No.
Do you have allergy?
Think no.
Do you have previous blood transfusion?
No.
So do you smoke?
Yes, of course.
Oh, okay. May I know how many cigarettes you have a day?
1 packet.
One packet a day. How long have you been smoking?
15 years about.
Okay, 15 years. You said you drank alcohol. May I know how frequent you drink alcohol?
About twice a week.
Twice a week. How much do you drink per time? Every time?
2 bottles or 2 cans of beer.
Okay. Do you have any idea? Do you have any family history of disease?
No, I think.
Do you have diabetes mellitus?
No.
Do you have any previous operations?
No.
Tuberculosis?
No.
Myocardial infarction?
No.
So beside the paracetamol that you took 3 days ago, do you took any other medications?
No.
Any childhood disease?
No.
So do you have hypertension?
Yes.
Do you know the pressure?
140/90.
How long have you been having this hypertension?
In about 5 years.
Do you took any treatment or medication?
No.
Okay.
General inspection. General condition of the patient is satisfactory, however there is slight violation on the respiratory system. Posture of the patient is lean more to the left side. The constitution of the patient is normal standing, however there is barrel chest observed. The subcutaneous layer is normal. Nail is in normal configuration and no brittleness. No edema of the skin.
What is your name?
Consciousness of the patient is alert. Patient is able to answer and respond properly.
I'm having pain in the chest.
Temperature of the patient is 37.8. On palpation, lymphatic system is normal. Muscular system, joint system, and bone system is tested by palpation in all regions, and it is all normal. Vertebral is in normal alignment and there is no abnormalities. Face inspection is being done. Facies pneumonica is observed. There is unilateral blush on the left side. Herpes labialis and herpes nasalis is also observed. System. Barrel-shaped chest is observed. There is no deformities on the chest wall. Chest half-lagging on the left side is observed. There is more superficial rhythm of breathing. Absence of pathological breathing. Skin color is slightly pale and cyanotic. Respiratory rate is 24 per minute. Left side chest lagging is observed from the back and from the front. Surface palpation of the chest is performed. Pain is indicated when palpation on the left lower side of the chest is done. It is observed that the chest elasticity on the left side is decreased.
So when I put down my hand like this, please say 99, okay?
99. 99.
Vocal fremitus palpation is done and vocal fremitus is decreased.
99.
Tenderness is detected at the left lower side of the chest. By palpation, the left side of the chest is detected to be more rigid. Comparative percussion of the chest is done, and it is observed that the left lower side of the chest has dull sound. Trap space was not able to be determined. During auscultation, no rails or crackles are heard. However, at the left lower side of the chest, there is missing of vesicular breathing. Above the side with no vesicular breathing, pleural friction rub is auscultated. Percussion is used to confirm the level of fluid. The level of fluid is marked properly. Auscultation is again used to confirm the level of fluid. Above the level of dullness, wheezing is heard. By inspection, patient has no abnormal pulsation, no phleboectasia, and there's no cardiac humpback. By palpation, the apex beat, ascending aorta, pulmonary artery, and breaking point pulsation is normal. Auscultation is performed and there's no murmurs at all points. Blood pressure is checked and it is 140/90. Peripheral pulsation of the patient is checked and everything is normal. Gastrointestinal system. By inspection, there is normal size, shape, and configuration of the abdomen. There is slight participation of abdomen in breathing. There is no scars, no pigmentation. Umbilical state is normal.
So now we're going to do some palpation at your abdomen area. First of all, please tell me Do you have any pain over your abdomen area?
No.
No? Okay. Do you have pain now? No?
No.
No? No?
Blood test is performed and it is negative.
No? 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 Okay. No?
By lifting the patient up a little bit, there is no hernia detected along the white line.
So, sir, after all the checking, I'm suspecting that you might have pneumonia with pleurisy. What we mean by pleurisy is that there is some retention of fluid in your chest, and that can explain why you are breathing so difficultly. And however, this is not totally confirmed yet. We still need to do some lab tests and also instrumental tests, that is X-ray. And for the lab test, we need to have to take some blood samples, urine sample, sputum sample, and throat swab sample to confirm our diagnosis to provide you a better treatment. Okay, so after this, we will have our nurse to bring you to the procedure room to take all this sample for the checking. Okay.
Okay.
So after all the tests just now, your X-ray result is out, and I would like to show you over here. So over here, you can see this is a picture that shows normal chest. This is not your chest, okay? This part is this one is yours, but a comparison for you, okay? So as you can see here, normally there will be black totally, but over here in your chest, we found out there's some opaque area at your left lower chest. That indicates there is some fluid retaining in your chest. Okay? So based on the X-ray result, we can confirm that there is fluid retention in your left lower chest. And this is very serious, and we have to do this surgery as soon as possible. And the surgery that we provide you is called chest draining, which is draining of the fluid out from your chest, because this fluid will actually compress your lung and you wouldn't able to breathe properly, and it will get more and more serious. Okay. So before I continue, I'd like to ask if you have any question about this surgery.
Yes. Doctor, how long is the surgery, the chest draining, going to last for?
Okay, the surgery itself is very short surgery. It will only last for maybe 20 to 30 minutes. And about the chest draining, because the draining of the fluid will last for some time, and there will be a tube inserted in your chest, like even after the surgery, until all the fluid is all out. Okay. Any other question?
Yes. Do I need to stay in the hospital for today?
Oh, yes, you do. You do have to stay in the hospital for today, because right after the surgery, we have to observe your condition, and the number of days of staying in the hospital will depend how you are recovering. And if you're recovering well, maybe tomorrow you will be able to go home.
Okay.
Okay. So yeah. Do you have any more questions?
No.
Okay. So before the surgery, we have to have you sign the letter of concern that you have you yourself have agreed to do this procedure.
Okay.
Let's go. Please sign over here. Let's see. Okay. Thank you. So before you will be admitted to the surgery, I'd like to remind you about your medical treatment that we provide you over here. So the medical treatment will include antibiotics, painkiller, and also mucolytics. Mucolytics is to dissolve your mucus a little more so you can cough it out easier, okay? And We will also provide you with some infusion therapy because you seem to have some dehydration. And also, in case you are having increased difficulty in breathing, we will also provide you oxygen therapy. Just let us know anything that you need, okay? We will be ready for you.
Okay, doctor.
And for this period of time before your surgery, please not to have any vigorous activity, and no smoking and no alcohol now, okay?
Okay.
Yeah, and that's all. Okay?
Okay, thank you, doctor.
Hello, sir. I'm here to have your preparation for the surgery that will be held at 6 p.m. this evening. Now it is 4 p.m. and I will ask some questions. Please cooperate in order to have this operation nice and smooth. Okay, so first of all, please tell me what is your name.
Alexander Ilic.
And what is your age?
50 years.
What is your height?
168.
And what is your weight?
60.
Okay, let me check if your ID band is on. Perfect. Okay, just now the nurse have passed you an informed consent to sign. Please check if this is your signature.
Yes.
Okay. Let me check if your surgical site is marked. Perfectly marked. Okay. Okay, do you have any dentures?
No.
Any braces? No. Okay. Do you have any contact lenses on? No. Any jewelry? Any rings, bracelet, or necklace? No. Okay. Any makeup or nail polish on? No. Okay. You have your clean patient gown. Okay. Have the nurse told your family where to wait? Okay. Have you passed all your valuables like your wallet, your watches to the family?
Yes.
Okay. Has the pre-anesthetic medication given? No. Oh, you're right. Okay. Okay. You're voided, right? Please allow me to check the. Okay. Just a moment. Let me check the volume. Okay, it's 100 ml. At 4 p.m. Okay. Has any mouth care given for you?
Yes.
Okay. Is there any allergies to any drug? Do you have any allergies to any drug? No. Okay. Okay, that's all. Just now, do you have any other question? No. Okay, you just have to stay here and have a good rest until 6 p.m. The nurse will assist you to the operation theater. Okay. Thank you very much.
Equipment needed: antiseptic povidone iodine, sterile gauze, drap, gloves, and occlusive dressing. For anesthesia, syringe, gauge, needle, and local anesthetic such as lidocaine is needed. For the procedure, needle of different sizes, 60 ml syringe, 3-way stopcock, drainage tube, specimen tube, and evacuated container. Ultrasound is used to locate and identify the site. The site is marked by a marker pen and is reconfirmed using the ultrasound. Povidone iodine is used to clean the area. The drap is applied to the area. Ampoules containing lidocaine is prepared. Lidocaine is taken up by a syringe. Before applying the needle for anesthesia, the patient is informed for slight pain during the enter of needle. After the anesthesia is done, synthesis catheter with a blunt needle introducer is prepared. A scalpel is used to open a small hole on the site. The catheter with the blunt needle introducer is introduced to the site. A slight amount of fluid is withdrawn, and when the fluid is detected, the blunt needle introducer is removed. The catheter is then again connected to a syringe to obtain fluid sample. The synthesis catheter is then joined to the tube, which is connected to the drainage system. 3 stopcock is opened and the drainage begins.
Hello, sir.
Yes.
It's now 7 p.m. How are you feeling after your operation? Everything okay?
No.
Any discomfort?
Slight.
Slightly? Okay. So far there's no pain, right?
No.
Okay. So sir, for the time being, you will have to be in this position while you're awake. Okay? It's to ensure your draining process will be smooth. Okay? So now I'm going to check your vital sign.
The pulse rate is taken. It is 90 per minute. The respiratory rate is taken. It is 20 per minute. The consciousness of the patient is satisfactory, 15, based on Glasgow Coma scale. The temperature is taken. While the temperature is taken, the skin is being checked and it is satisfactory, no sign of dehydration. The pulse oximetry is properly intact and the value is 85%. The temperature at 7 p.m. is 38 degrees Celsius. The blood pressure is taken and it is 140 per 90 mmHg.
Doctor, I have questions.
Okay, please ask.
When this thing can be removed?
Okay, this infusion therapy, we will only remove it when your condition is stabilized. Okay, so we will observe you today and also tomorrow, and if everything seems fine, then we'll remove it earlier. Okay.
Okay.
The infusion is properly placed. The drainage tube is properly intact at the site of the wound. The amount of drain at the time is 200 milliliters.
So after the checking, everything seems fine, and now I will be advising you about your diet. Okay, so after this, you may have some light meal like porridge, and starting from tomorrow morning, you can have your regular meal. Okay, and for the position, it is advised for you to have your position most of the time when you're awake in this position to allow proper drainage. Okay, and when you're asleep, it's advised to sleep on your right side. Okay, just sleep at the side. And the nurse later they will come and help you to perform deep coughing exercise and also back rub. Okay, every day. And for your drugs that you will be taking is antibiotic and painkiller. Okay, so this antibiotic and painkiller, you will take them 3 times a day each, okay, after meal. So after your breakfast, take 1 antibiotic and 1 painkiller, and after your lunch, another time, and after your dinner, another time, okay? So during this treatment, it is advised for you to stop smoking and stop taking alcohol. I know this is hard, but for good recovery, it is advised to do so, okay? And for your mobility and your daily regime, basically you can do everything you want, but you have to avoid big movement and don't do any strenuous activity, okay? So when you take something, minimize your movement. And daily regime, you can do it as normal as well. However, during bath, avoid having water contact to your wound. Okay, you may cover it with a plastic when you bath, or just wipe it clean, wipe the surrounding clean with a cloth. Good morning, sir. How are you feeling this morning?
Better.
Any discomfort?
No.
Okay, I will now do some checking on you, okay?
Pulse is symmetrical and it is 90 per minute. Respiratory rate is 20 per minute. Blood pressure is 135/80. Temperature is 37 degrees Celsius. Skin turgidity is normal. And pulse oximetry is 89.
Sir, do you still feel difficulty while breathing? Is it still painful?
No difficulty, but pain little bit.
Okay.
Amount of urine excreted since 10:45 p.m. is 450 ml. The color and transparency is normal. The drainage side is clean and normal. Through the checking, infusion therapy is decided to be removed. At 11 a.m., vital signs are all normal. Palpation, percussion, and auscultation is again used to check the local status of the left lower chest.
So we will have to do another blood test for you to see the effectiveness of the drug, and also we will do another x-ray.
Based on your x-ray examination, we can see that the fluid has been removed.
The drainage process has completed, and I will now remove your drainage tube.
Vital signs are checked and everything is normal.
We have some good results from the blood test. According to the blood test, it seems that your body is recovering and your immune system is fighting. And you'll be allowed to go home at this afternoon at 12 p.m.
Morning, doctor.
Okay, how are you feeling today?
Yeah, better.
Better?
Healthy.
Okay. Alright, your seems fine and all your signs are quite stable, your condition is quite stabilized, and you're allowed to go home this afternoon. But I have to remind you that you do have to continue taking your medication. For your antibiotics, you have to take them until the 18th of October, which is 10 days. I'll label it for you, okay? And your eucalyptics and your painkiller, you have to take them for another 5 days. Okay? I'll label everything together, but do remember to take your medication, okay? And on the 18th of October, please come back to the hospital and I'll have you a checkup. Okay? You have to continue your antibiotics for another 10 days. Do not stop in between because this will affect the effectiveness of your antibiotic functioning in your body, okay?
Okay.
Hello sir, how are you?
Yeah, good, fine.
You're looking very healthy.
Yes.
Okay, since you have very obediently, you have took all the medication as told, and you're recovering very well. Do remember next time not to get the cold. Do remember to have proper wearing during according to the season. Don't get the cold. You know how hard it is for you to recover from this disease. Okay, take care and good luck.
Okay, thank you, doctor.